what are the strengths/advantages of PAD specialists versus other options for PAD evaluation and treatment?
So first of all, I would say that we are not the only providers out there who evaluate and treat PAD. There's a lot of others out there. There's hospital-based providers, there's ASC or surgery center-based providers, there's other OBL-based providers. All of our work is done in OBLs, office-based lab. There's others. There's multi-specialty groups, there's cardiology groups, there's vascular surgeons, there's interventional radiologists. There's a lot of others that evaluate and treat PAD. And a lot of them are excellent, frankly speaking. We have a lot of respect for them. Yes, there are competitors. They're not our enemies. They have the same goal as us, which is to find PAD early and treat it appropriately and assertively to prevent further tissue damage in patients. So I tip my hat to them because they're doing excellent work to help fellow Americans find and treat their PAD. That being said, I think we have some relative strengths compared to some of them. Number one, very unique. What is our name? PAD specialists. It says it right there. All we do is PAD. For over 60 years now, all we've done as a team of over 200 employees now, we specialize in PAD. Most other providers, while they may be good, not to denigrate them, they're generalists. They do other things. Maybe they do varicose veins, maybe they do coronaries, maybe they do carotids, maybe they do aortas, maybe they do tips, maybe they do fibroids. Great, good, wonderful. We believe in specializing. We believe that specializing, not just for our physician proceduralists, but even for our staff, our clinical staff, our front office staff, our insurance verifiers, we specialize in this one thing. So we believe specialization makes one stronger, rather than doing a little bit of everything. So that is one advantage. As far as I know, we're the only provider in the nation that focuses on PAD only. Thus our name, PAD specialists. Number one advantage. Number two, many of the other options you have for PAD evaluation and treatment are actually done in the hospital outpatient setting. Nothing wrong with that. I have a lot of respect for the hospital. They do a lot of valuable care for patients and for society. That being said, for non-urgent PAD, I think the OBL is a better option for a few reasons. One, it's much easier, the logistics, it's much easier to park, to navigate, you don't get lost like in the hospital. Service is a little more personal, right? The hospital sees a lot of patients. Sometimes you feel like a number, right? You'll get better service in the OBL, in our OBLs. Better customer service. In addition, wait times, right? Hospital, we've all been there. You have to schedule an appointment, you have to wait 3 weeks, 4 weeks, 6 weeks. Not with us. We'll usually see you within days of your referral or max like a week. You won't have to wait long. Further, when you come see us, in the waiting room, you're not gonna wait long. We're a finely tuned machine. We value your time, we're gonna see you quickly. Finally, in these pandemic eras that we live in, the risk of COVID transmission is lower. We of course practice social distancing and mask and we sanitize everything and all that. Hospital does the same thing. That being said, there are COVID patients in the hospital, right? In their ICUs on vents. So in theory anyway, the risk of COVID transmission will likely be higher in the hospital setting than in our OBL. So that's another benefit. Finally, costs. Something very few people talk about in healthcare, but it's important. I believe we should talk about it. Value-based medicine is the name of the game, right? Healthcare is one-fifth of GDP. Costs keep going up. America's getting fatter, more diabetes, more illness. We have to figure out ways to provide high-quality care at low cost. Where we provide our PAD services, evaluation and treatment, is significantly lower. Our OBL, significantly lower cost than the hospital setting. On average, about 60% lower costs. That cost is passed on to the payers and therefore society, but also to the patient. The copay for the patient will be very low, $25, $50 usually, whereas in the hospital, oftentimes there'll be larger bills. And I would say, if you're gonna get brain surgery, get it in the hospital. Costs be damned, right? Highly specialized care like that, you need in the hospital setting. Non-urgent PAD is just as good or better in the OBL setting at a significantly lower cost.